The AirLife non-invasive ventilation full face and nasal masks offer clinicians reliability while providing patients comfort and stability. Made without DEHP, AirLife NIV masks are for single patient use only. They are designed for spontaneously breathing adult patients weighing greater than 30 kilograms or approximately 66 pounds who are experiencing respiratory insufficiency or failure and who are suitable for non-invasive positive pressure ventilation. These masks are contraindicated for patients with the following conditions: impaired cardiac sphincter function, excessive reflux, impaired cough reflex, or hiatal hernia. AirLife NIV masks should not be used on patients who are unresponsive, obtunded, or a dulled level of consciousness, unable to remove the mask, or uncooperative. Now let's take a look at some key design features of AirLife NIV masks. All AirLife non-invasive masks have a flexible double swivel elbow. This design helps to reduce torque on the mask and therefore may aid in maintaining a proper seal. The elbow allows the mask to flex in a third plane, thus allowing for some give if a circuit is pulled or the patient moves. This feature stands out from many of the inflexible hardshell NIV masks in use today and may help reduce pressure points on the patient's face. All masks come with a comfortable 4-point headgear and a crown strap, which adds to its stability on the patient's face and helps ensure an adequate seal. The mask itself has two main components: a soft shell, which includes the cushion, and a plastic frame. The cushion conforms to the patient's face, reducing the need to over-tighten while maintaining a comfortable seal. Its soft shell design allows the entire mask to flex and aids in its ability to fit an individual patient's face, which is another feature many other hardshell NIV masks on the market do not offer. This cushion also includes a well with a large amount of material over the bridge of the nose. This design helps provide a comfortable seal. The nose is where skin irritations and breakdowns seem to have a high occurrence in non-invasive therapy, per a respiratory care published article. The adjustable forehead support with large, soft pads offers comfort and stability. With the ability to adjust, the pads can be placed against the patient's forehead to increase stability of the mask by limiting its movement on the face. The pad design aids in reducing pressure on the patient's face by adding surface area and transferring some of the mask pressure to the forehead. Another important feature of the mask is the anti-asphyxia valve, also called the AAV, or safety valve. The AAV is a one-way valve that closes during normal positive pressure ventilation. Should mechanical ventilation suddenly be interrupted with the mask still on, the one-way valve will open and allow the patient to breathe room air, avoiding possible asphyxiation. Lastly, all AirLife non-invasive masks have quick-release buckles, which can reduce the need to refit the patient each time the mask is removed. This limits the risk of over-tightening when masks are reapplied multiple times during a patient's stay. AirLife NIV masks are available in several options: vented with anti-asphyxia valve, AAV, non-vented with anti-asphyxia valve, and non-vented for use with critical care ventilators. If you are using a non-invasive ventilator and a single-limb circuit that contains an inline exhalation port, use an AirLife non-vented NIV mask with an anti-asphyxia valve. If you are using a non-invasive ventilator and a single-limb circuit that does not contain an inline exhalation port, use an AirLife vented NIV mask with an anti-asphyxia valve. If you are administering non-invasive ventilation therapy using a dual-limb circuit and critical care ventilator, like the Avia for example, then use an AirLife non-vented NIV full-face mask without an anti-asphyxia valve. The elbow connections differ between the vented and non-vented masks, helping to reduce the risk of missed connections, as you would not want to place a non-vented mask on a circuit that does not contain an exhalation port. To choose the correct mask size, using the disposable sizing guide, first determine which type of mask will be used on the patient, full face or nasal. Then orient the guide so that the mask type name is located at the bottom. Ask the patient to remain closed-mouthed during this exercise for accurate sizing. Since the medium size will fit many patients, start with this size. Here the full face mask is being fitted. Start by placing the guide on the patient's face. The top of the cutout should be placed on the bridge of the nose. The bottom of the cutout should be positioned between the patient's bottom lip and their chin. If the guide is too close to the patient's bottom lip or chin, use the small or large size mask cutouts on the guide to determine the right fit. For nasal masks, place the top of the cutout at the bridge of the nose. The bottom of the cutout should be positioned between the nose and top lip of the patient. Note that if the patient is in between two sizes, the larger size should be used. To place the AirLife NIV mask on a patient, first unbuckle the bottom two straps. Place the mask on the patient and hook the plastic buckles onto the mask frame. Adjust both upper headgear straps to a comfortable tension. Then do the same for the lower straps. You may notice that the top or bottom of the mask is tighter against the patient's face. If the forehead support is too far advanced, then greater pressure is on the forehead and the bottom of the cushion or chin area. If it is not advanced far enough, then greater pressure will be exerted on the forehead and the top of the cushion or lip area. Adjust the forehead pad by squeezing the fins until the top of the cushion, the bottom of the cushion, and forehead pad all rest on the patient's face evenly. This will help to reduce single pressure points on the patient's face. Make sure the overhead strap is in a proper position to avoid it sliding down the back of the patient's head. To remove the mask and headgear, unhook both plastic buckles from the mask frame and pull the upper headgear strap away from the head. For quick access, simply unhook one plastic buckle from the mask frame. Clean the NIV mask using warm water with a mild soap. Do not use bleach, chlorine, or alcohol to clean or disinfect the masks. Follow your facility's procedures for discard of medical devices. Thank you for taking the time to view this video. For more information, reach out to your AirLife representative or visit us online.